All right, good evening, everyone, and welcome to ATP Live Monday. Welcome. I hope you've had a beautiful first day of the week. You are welcome to ATP Live Monday. I am Mimi Salaboide. I'm a pediatrician and CEO Ask the Pediatricians Foundation. My job this evening is to answer any questions that you may have for a pediatrician over the next 1 hour. So feel free to share the video, invite your friends and family, everyone you know that will have a question. Thank you, Jessica, Phone Kids Beauty. Thank you. I'm doing fine, Jessica. Thank you for asking. So, welcome to ATP Live Monday. I'm so happy to be here. We're gradually running to the end of the year, and I guess maybe I just have about 4 more ATP Live to do because we tend to wind down by the 18th thereabout of December, and then I'll be seeing you all in 2024. So we still have about a month more of ATP Live. So feel free to ask any questions that you have, and just do me a favor and share the video. I'm going to do the same and share the video, pin it to all our various groups. So while I'm doing that, feel free to start to drop your questions, and I will do my best to answer them in the next 1 hour. Remember that after the live session, that is not all. If you still have questions beyond the live sessions, you can always post your questions on Ask the Pediatricians Facebook group, Mondays to Saturdays, and we will be there to answer your questions as well within 24-48 hours. We'll try and do our best to answer your questions, maximum 72 hours. So, and if you have health questions that are adult health issues, you can also post it to ATP Family. And we also have 2 other groups, ATP Still a Mom and ATP First Time Moms group. So there are lots of opportunities for you to ask any questions that you have. And remember, you can also listen to our podcasts on Ask Dr. Bemi ATP podcast. And then you can also watch some of these videos, all these videos on our YouTube channel, ATP TV. And then you can also read on our website. So our goal is to make sure that you have all the information you need to raise healthy children. Our mission on Ask the Pediatricians Foundation is that no child should die from preventable illnesses or preventable conditions. So we do a lot of health education, health information, health promotion, and we also do outreaches. And currently we're doing our first aid schools project, and some of us, I'm sure you've seen some of the pictures. So you can always support us. We are doing this project, going to the schools and teaching people on first aid care. And we have the online version for those of you who want to be part of it. Let me try and see if I can share the picture. Oh no, do I have it? Yeah. So, and there's a I think we'll put it's on our Instagram. It's on some of our pinned post on Instagram. So there's a scan. There's a QR code for you to scan and to take you straight to the online course, and you can download the leaflet. So you need to know what to do if there's an emergency. For most common medical emergencies, somebody is collapsing, somebody is convulsing, somebody is having an asthma attack, and you need to know what to do. We have all those information there. We have it on video, we have it in written, so you have opportunity. And we're actually targeting our secondary school students because we want to catch them young. We want to raise a generation when they see medical emergencies, they don't just bring out their phones and start taking videos and pictures, or they start pouring water, or start doing all sorts of things that don't help, but rather that actually can hasten the person to to the grave. So we want people to know what to do, because sometimes those first few minutes after an emergency are so critical. And if somebody knows the right thing to do and they do it, like if somebody needs CPR, somebody is doing the CPR and all that, you may actually save lives. And if you watch some of these YouTube videos, you will see a lot of testimonies of people that survive heart attacks and condition, because when they had an attack or when they had that collapse, there's somebody who is thinking right and knows what to do, in terms of somebody who just collapsed, and that's the only reason why they are still alive. So we want us to also have want our students, many of us to have that skill set, so that they will know what to do in case of medical emergency. So that's what we're doing with the school first aid care project, and we'll very be grateful. We want to thank all those who have supported us, whether it's 1,000 naira, 10,000, 100,000 naira. We want to say thank you. And if you want to support us, please, we still need more. Our goal is to go to all the secondary schools in Nigeria, and we're just still in the pilot phase. And so please support us. Okay, I think I've shared all the videos while I was doing all the talking, and then we can start to answer our questions now. I just need to pin a couple more videos, then we can start. So if you have any questions about the health of your children, please put that there. We can also answer questions about mothers, family planning, and stuff like that. But any other thing beyond that, I'm a pediatrician, and I try to abide by my calling. All right. And please, when you're asking questions, please start with the age of your child. It is so important for a pediatrician to know the age of the child, because we deal a lot with different age category from 0 to 18 years. So if you just say my baby, it won't make much, it won't help us. And there's a question you will ask if something is present in a baby, or if it's present in a 5-year-old, the answer I'm going to be giving will be completely different. So that is why it's so important for us to know the age of the child, and then we can actually, provide appropriate answers. So thank you, Facebook people. I can see you. You're welcome. Facebook use, if you don't give StreamYard permission, I won't see your names. I only see you as a Facebook user. That is perfectly fine. But please, if you're asking questions as a Facebook user, don't break your questions. Don't give follow-up answers. And I won't be able to link them together, because there are many Facebook users. So you have to make sure that all your comments are in one comment. And if you are going to put any additional comment, you have to start again and put everything back, because that's the only way it will make sense. But thank you so much for joining me. All right, so enough of intro. Let's go to the business of the day and answer all the questions. So I'll start with Instagram, and I can see a question from Jessica. Please, my son, I think you meant my son has speech delay, not conversational. How old is your son, Jessica? So that's obviously you've asked a question before I give my introduction. All right. Always start, okay, your son is 3 years old. Okay, if a 3-year-old is not having conversation, that is delayed speech. We want 3-year-olds to be speaking sentences, and we want them to be able to have a conversation back and forth. And you said, what is the cause? There are many causes of speech delay. It could just be an isolated speech delay, or it could be part of other bigger medical, or what we call developmental disorders, like global developmental delay, autism spectrum disorder, cerebral palsy. I mean, many conditions can also present with speech delay. So the most important thing is to see a speech therapist. Speech therapists are the specialist professionals that deal with speech and language delay and stuff like that. And so they will do an assessment, and then they will tell you what your child needs, whether it's speech therapy. Most of the time, they want to do a hearing test. For example, a child could also be deaf, and deaf children would, by extension, may not be having speech as well. So first, we want to check the hearing. If the hearing is fine, then we can now focus on the speech. And then there are lots of speech therapies, exercises, and stuff like that that you can do with your child. If they suspect your child has wider developmental disorders like autism and all that, they may refer you to us developmental pediatricians to do a proper assessment for the child. So, and the earlier the better, because we talk about what we call early intervention. So, the earlier a child gets an assessment, especially when they are below the age of 5, because there's what we call the plasticity of the brain. The brain is still developing. So, if there are issues around that first 5 years of life, the earlier we start doing the right therapies, the better the outcome, and the children respond better. So you really need to see a speech therapist, get them to assess this child, and then tell you the way forward, whether it's just therapies or whether the child needs further assessment. I hope that's helpful, Jessica. If you have any other clarification, you feel free to ask. Ugoto, how often should we deworm children? 3, 6, and 8. Every 6 months is fine. So, depending on where you're asking your question from, because I have a global audience. So, there are countries where they don't deworm their children at all. But in countries like Nigeria, Sub Saharan Africa, where we have what we call worm infestation being endemic. In other words, we have worm infestation all the time. And, most of us our children walk around, they play, they touch things, they put it in their mouth, and all these worms are everywhere. So the likelihood that our children will get exposed to worms are quite high. So in those countries, the World Health Organization recommends that we should deworm our children every 6 months. And worm expellers, you don't need to get a prescription from a pediatrician. You can just walk into any pharmacy and you can buy a worm expeller. And there are a lot of them. We tend to recommend albendazole. Albendazole can come in tablet, can come in liquid, but the good thing is that the dose is the same for children from 2 years old and above. So if your child is 2 years old to your own age as an adult, it's still the same dose of 400 milligram tablets, or if it is come as liquid, some will be 400 milligram in 20 mils, some will be 400 milligram in 10 mils. Just look at what is there and you give it, and it is just once, and then the next time will be in 6 months' time. If your child is already having worms, your child is already passing worms, that is not the worming. That child already has one. That is treatment. So for treatment purposes, you have to see a doctor, because usually we will give the worm expellers for longer, and the time we will give may also differ. So we'll give it for maybe 3 days and repeat it in 2 weeks. But if your child is not passing worms, we're just deworming the children every 6 months, one dose of bendazole, 400 milligram for children up 2 years old and above, and 200 milligram for children below the age of 2 years, at least 1 year old. And we usually say start from the age of 1 year. Don't deworm children less than 1 year, because we don't expect those children to have been exposed to worm, because most of the time they are with you at home, you're carrying them, so their own chances are very low. But once they start walking, they start moving around, they start going out of the house, yes, so we should start deworming them. And every 6 months we do, not every 3 months. A lot of mothers like to do every 3 months. That is overkill. Just every 6 months we do. All right. Damilola Odose, my 5-month-old baby has gained head control. Good. But at times you see a red lag. So you are confusing me. It's either your child has neck control or your child does not have neck control. There's no middle ground, because you are telling me now that your child has neck control, but sometimes the child has head lag. So that is confusion. So what I would recommend is that you see any of my colleagues, any of our doctors, pediatricians, let them do it for you. There's a simple way we can check for head control. So what we normally do is that if you want to pick your child up, you grab the two hands and just try and raise the child. A child who is lying flat, let's say on the couch, and then you raise them up with just their hands. A child who has neck control, the head of that child comes up with the rest of the body. The head will come, and it will come in line with the rest of the body. So the head and the back, everything moves together. But the child has head lag. When you are doing that, the neck will be falling back. you're pulling the child up. So when you're pulling your child from a what we call supine position, lying flat, only with the hands, and the head is still going back, that child does not have neck control. And if the child is 5 months old, that is developmental delay. That child needs to see a pediatrician. Okay, so there should be no middle ground. At 5 months old, the neck control should be perfect. It should be there all the time. There should be no, it's there, it's not there. No, it should be always be there. And if it's not there, I will worry about it, because that's my job as a developmental pediatrician, to worry about it. All right, so Jessica is asking additional question. We'll take one Jessica question, then we'll go to Facebook. Thank you, ma. Please, how much can too much screen cause autism? Too much screen does not cause autism. Autism is we think it's more likely a genetic condition. In other words, a child who is going to have autism most likely has been born with autism. It's been around in some families. It tends to be common in boys, and it tends to occur along certain genetic conditions like fragile eggs, Rett syndrome, and the rest of them. Some people think there are maybe some environmental factors as well, but definitely not because the child is looking at the screen. The child does not get autism from looking at the screen. The child may be looking at the screen and be addicted to the screen as part of one of the repetitive features that we see, or peculiar, what we call restricted behavior that we see in children who are on the autism spectrum. And there's nothing like visual autism. Autism is autism, and we tend to call it more properly autism spectrum disorder. So it's either a child has autism or the child does not have autism. There's no visual autism. There's nothing autism. There's no, people tend to tell me, oh, my child has small autism, has mild autism, has no, autism is autism. It's either your child has it or your child does not have it. What we normally tend to qualify autism with is the level of the symptoms. So some children have very high level of symptoms and they need high level of support. So there are children who are completely not talking, who have a lot of repetitive behavior, who even you as a parent, you can make a diagnosis of autism in them, because you see it, you will see all the textbook features of autism. Even you don't need a pediatrician to make that diagnosis. We'll call that level 3. But there are also children that are talking. There are children who are doing extremely well. Some of them are extremely brilliant, and they can talk. They talk like professors. They know everything about maybe anything they are interested in. Maybe some people, I know children who, like in UK, they know all the train station. They know all the colors. There are children that know all the dinosaurs. These children cannot talk, but they can tell you all the names of the dinosaurs that I myself as a pediatrician I don't know, but they can tell you everything about it because that is their interest. So that is another level, that's another kind of autism. So those kind of children may not even need as much support. They may be level 1 kind of support. So, and then most children are in between. So it's a huge wide spectrum, and every child is different, and every child, but they will all have the core features of autism. And what are the core features of autism? They struggle with what we call social reciprocity, social interaction. That is number 1. All children with autism will struggle with that. They're not likely going to be making friends. They're not likely going to be interested in other people. They just want to be on their own and all those kind of things. They may not respond when you call their name. They may not be able to have conversation back and forth and all that. That is A. Then B, they have what we call repetitive or restricted behavior. Some may flap. Not everybody have to flap. Some may they may opening the door up and down. They may be very peculiar. There are children who will not eat a biscuit that a little bit of it is chipped off. It doesn't matter. There are children that will only eat a particular kind of food every day for breakfast and nothing else. And some children will only take a particular route, and they can never take any other routes. You're going to have a meltdown doing that. And then some have sensory issue. They block their heads to loud noises. Some cannot tolerate having haircuts. So, all those kind of sensory issues. So if your child is having all the A and the B, and you don't need to have all the B's, we only need 2 out of 4, then that child meets the criteria for diagnosis. So it's a clinical diagnosis. Pediatricians who are trained, speech therapists and other professionals who are trained in doing the assessment, they do the assessment and they make the diagnosis of autism. And then depending on how much support the child needs, they will tell you what support the child will need. So it is very, very important that the children have the diagnosis so that they can get the right support on time. So I think I will stop there about autism because I just need to correct, because there are lots of misunderstanding about it, especially in our own part of the world where we don't tend to see a lot of people doing the proper assessment and diagnosis and all that. So if you're worried, Jessica, about autism, please let your child have a proper assessment by a trained professional, developmental pediatrician, trained speech therapist, psychologist. Those are the people that do autism assessment. All right, I would jump to Facebook. Instagram people don't go, just stay there. But let's start answering Facebook people before they start getting upset with me. All right, first question from Facebook. My daughter, 2 and 5, have been throwing up to them to the clinic, tested malaria, 3 days injection. Every time I see questions of malaria, and the next thing is they were given injection. It is wrong. I don't know why our private hospitals always feel the need. And I really want to know whether we, the parents, are the one insisting that our children should be getting injections. Please, as much as possible, children don't need injection for malaria. They can take their drugs by their mouth. And that is the best way. We only give injection for malaria in a child who is really very sick. That child has to stay in the hospital. Most of you will say you are taking injection, but you are going and coming back home. That is not injection kind of malaria. That one is not ordinary malaria, simple malaria, and you just take oral drugs. Unless the children are really vomiting so bad, they can, when they take the drug, they are vomiting the drugs. But otherwise, most of the malaria should be treated with oral drugs. And I'm telling you because I want you as a parent to know the right thing. So when next your child has malaria, you go to the hospital and they say they're going to give your children injection, say no, I will take tablets. That is the right way for malaria to be treated. If your child is very sick and is lying down and they have to admit your child, that is the only time they should be giving injection for treating malaria. Otherwise, a child who is walking, running up and down, eating, that child should take malaria drugs by mouth, not injection. Because the next time people are going to come and say, oh, my child cannot walk again, he's limping, because they've injected the nerves. Please avoid injection as much as possible in children. There's no extra advantages. There are no advantages to taking injection instead of tablets. They're actually more risky. And we as doctors, we will rather give you drugs by mouth rather than through injections. So this habit in Lagos where everybody who has malaria has to get injection, we need to stop it. It's wrong and everybody should know that. And I want to rely on parents knowing the right thing so that when they offer you, you say no. I don't know why they always do that, but anyway, that's just an opportunistic to give an information. All right. So your children are still throwing up, they're still running temperature. Please go back to the hospital and let them see your child. Everything is not malaria. We're always quick to jump on malaria wagon. A child is having vomiting, malaria. No, there are so many other things. Sometimes it's just as simple as a viral infection that doesn't even require any treatment. All you need to do is to make sure it could be food poisoning, because if all your children are vomiting at the same time, it's very unlikely for all your 3 kids to have, or 2 kids to have malaria at the same time. So is this something they had? Is this something else going on? So there are many other things that could make children to have vomiting, fever. Malaria is a possibility, but it's not always malaria. And if your child is already on treatment for malaria and is still having symptoms 3 days after, when was the first day? Friday, exactly. Today is Monday. Then most likely it's not malaria. Most likely we'll be dealing with something else. I would recommend that you go back to the doctors and let them have a review of the child. Okay, that's the Facebook user. Just go back to the hospital. This is a standard response because I get a lot of all these questions. Have been to the hospital. My child is on treatment. My child is not better. What do I do? You should already know what to do. All right. And I think our doctors, we are the one failing you. We should have been telling you. Ideally, when you go to the hospital, when we start you on treatment, we should tell you when to come back. We should tell you if your child is not better in day 1, day 3, or day 5, come back. or you do this comeback, we should always give you that information. But I think most of us are, maybe we're too busy. That's not an excuse anyway. But just to let you know, as parents, if you take your child to the hospital, a doctor is treating your child and the child is not better, or the child is having more symptoms, or something different that you were not even thinking of before has started again, like you took some drugs and your child come out with rashes, you have to go back to your doctors. That's what we call follow up. Follow up is part of management. Ideally, we should ideally follow up all cases, but of course, it's almost unrealistic and difficult. But if the child is better, of course, we are happy. If you don't want to come back, that is fine. But if a child is not better, the child is having more symptoms, you are seeing something you were not expecting to see, please, the most important thing to do is to go back to the same doctor. Please don't assume that the doctor does not know what they are doing. Don't assume that that means that doctor is a fake or is not skilled enough, Kubonoto or something. No, there are reasons why that will happen. Maybe I will take one day to talk about all that another time. But please, the right thing to do, and don't go to another doctor, which is what some of us do. Let me go to another doctor B. You're going to just waste more time because Dr. B will now start afresh. Whereas Dr. A already knows where he started from, where he has ended, and what is likely going on. So it's better to go back to the same doctor for follow-up, unless you are going back and you are not, you have a system that maybe this doctor, or you are not sure what they're doing. Fine, it is okay to go for a second opinion, but the right thing to do is to go back to the hospital and let them see your child. My child has taken malaria drug for 4 days and it's not better, because that will also help that doctor to realize, is it possible I'm not dealing with malaria? Is it possible it's a fake drug? Because that's another thing we have to think about in Nigeria. Is it that the drugs are not working, or is it because they are fake, or it's not? Sometimes some children don't respond to certain drugs, not because that drug is wrong. The child just doesn't respond to it. QED, and we just have to try another one. So these are the things the doctor will think about and deal with. So please take the children back to the hospital. Let's just stop it at that point. Okay, onward, Amanda. My son has cough catarrh. Is on antibiotics. Always have the question with the age of your child, Amanda. I notice when he wakes up in the morning, his body will be hot. When I check the temperature, it will be okay. So the thermometer is more objective than your hand, okay? So if you touch your child's body and you think it's warm or hot, and the thermometer is correct, saying that there's no temperature, there are two things. It's either you are using a thermometer that is not good, that is not working, or your own hand is not working. So it's either of the two. But most of the time, the thermometer is correct, and our hands are not reliable. And I always like to separate. That is why we actually have to invent an instrument called a thermometer, because we cannot always rely on our own hand. Even if you are feeling warm and you touch somebody else, you will think they are warm, whereas you are the one feeling warm. So you should rely on an instrument. You can get a different thermometer and try, or you can take the charge so they can check for you. And if the temperature is also same, then that means there's something wrong with the thermometer, and your own perception is what is wrong. So so what I checked temperature to be okay. So there's nothing to worry about that. You didn't tell us the age of your child, so I can't give you more specific information. But if your child is having cough, catarrh, fever, and they're having difficulty with breathing, you have to take them to the hospital. Just to remind us, yesterday was the World Pneumonia Day. Pneumonia is one of the top killers of our children, and that's why we have a day like yesterday, 12th of November every year, to remind ourselves about pneumonia. And we worry about pneumonia in a child who is having difficulty with breathing, in addition to the cough and the fever that they are having. But if your child is just having cough and catarrh, no fever, I will not worry so much, because most likely that is due to a virus, and most of them don't require any treatment, and they will go away by themselves within 2 weeks. Depending on the age of your child, make sure your child is warm. If the child is, that's if your child is cold, because people will tell me my child is already sweating. So please, I'm not saying you should overdress a child who is already sweaty, who is already warm. We're talking about a child who is feeling cold to touch and all that. Yes, you can wear additional layers for them. Make sure they drink warm liquid. If your child is less than 6 months, that is just breast milk. Breast milk is warm already, and you don't need to any other thing else. For children above 6 months, you can give them warm liquid and all that to drink, or food and all that, and that's all. Usually, it will resolve by itself. So you said what causes heat rashes? Heat rashes is caused by heat. That's why they call it heat rashes. But please don't make assumption every rash is heat rashes. Mothers like to call rashes three things. It's either it's heat rash, measles, or chickenpox. Those are the only three rashes mothers like to make a diagnosis of. And I've seen so many pictures sent to us on our Facebook group of so-called heat rashes. They are not heat rashes. Okay, heat rashes are so easy to see. You will see that if you look as if the child is sweating and the water is trapped under the skin and it's clear, and they tend to happen on the exposed area of the body. So they tend to happen on the neck, they may happen on the hands, exposed area usually, that, and or even the face. So, and they usually very tiny, tiny, tiny dots. They may have little water in them, or they may look a little red, but they are tiny dots all over the place. And usually, what you need to do is to make sure you reduce the heat. So let the child be warm, be cool. Make sure the room is well ventilated. You can even use your heat rash powder, and the heat rashes will go away. So if your child is having rashes that are not going away, and that they are not in the usual area where we see heat rashes, please don't make assumption of heat rashes. Let a doctor see the rash and let them tell you what it is, because most of what we call heat rash, actually, those heat rashes should not be, they don't take more than 1 or 2 days or 3 days, they all clear, because they tend to kind of, after a while they tend to dry up and then they just clear. So your child is having rashes going on for days and weeks, it's very unlikely that they are heat rashes. So for those kind of rashes, it's best you see a doctor and let us tell you what kind of rash. So if by the time you're asking me what is the cause of a heat rash, then I'm suspecting that that is not a heat rash, because you will not be asking the cause of a heat rash, because you will know that that's it. And usually you will know that it tends to happen, maybe the weather has been so hot, you don't have fan or AC, and everybody is sweating, and then when you now see heat rashes, that one is very easy to figure out. But otherwise, it may be something else and not heat rashes. Okay, let's move on. Another person, maybe it's 5 months, 1 week. He has serious scabies. Oh, really? Scabies, there are some diagnoses when parents use. I'm very skeptical, because there are some diagnoses that only doctors should make. So I hope you are correct with your scabies. Um, and you say you suspect it is a crash because his siblings do not have it. You were given permethrin, blah blah blah. By who? Okay, at the clinic. Okay. The itching is not allowing him sleep at all. And I was asked to use a cream, but the spots are still there. How soon is the itching supposed to stop? When should I go back to the hospital? Um, Scabies. You can go back to the hospital. Uh, because how long have you used the treatment for? Anyway, when did you go to the hospital? Oh, yesterday. Okay, you just went to the hospital yesterday. At least give it some time for you to finish the treatment. I just hope the diagnosis is correct anyway to start with. That number two, Puritan, 5 month old, neither here nor there, but I'll be very reluctant to use that. And then uh, you can go back to the hospital at least do 72 hours. I will even just say 5 days before you start rushing back to the hospital, because you just started treatment yesterday evening. Just a day. I'm not expecting everything to go. But the more important thing is hope the diagnosis is correct, because it's very unusual for a child to have scabies. So let's okay, maybe another child have scabies in the crash, like you said, but very unusual for one person just to have it and nothing else going on in the family. So that is number one. But if within the next, okay, let's just say 2-3 days, you are not happy, the rashes are worse and itching is still there, and usually scabies tend to be in the web of the fingers and all that. So, and I didn't notice you mentioned that you said the head and the feet. So I'm really very worried about that diagnosis itself. So, but then I've not seen it, so I won't want to comment on that. But you can always go back to your doctors and make sure that they get it right. Okay. We're saying I do want them in September. I don't know about. So if you're asking question as a Facebook user, please you should not break, because if you break, I won't be able to tie it together. So you have to be very careful. Okay, Amanda is here asking, is it the same baby, the 7 month old with cough and catarrh, is on antibiotics, have rashes on his body, blah blah blah. Okay, you use Sebamed, it's not going. And okay, it's the same question I just answered. So number one, I don't think your baby has itch rashes, obviously. So please see your doctors again. Two, if your child has cough and catarrh, there's no need to give antibiotics, especially if there's no fever and all that. So, and antibiotics itself can cause rashes depending on the type that you are given. But since you are still having all these symptoms, you can go back to your doctors for follow up and let them check. If your your baby's temperature on the thermometer is normal, then it's likely your child does not have any fever. And your child prefers swallow more than baby food. There's no baby food, okay? Food is food, okay? And there's no food that your baby cannot eat. So pap, I take pap as well. So it's not baby food. If I can take it, I'm not a baby. So food is food. And your child from 6 months, they can eat all the food that you eat. So your child has preference for some food, it's okay. Just give them what they like, and also try and introduce, but it's not compulsory your child has to take pap. It's not compulsory they have to take a particular cereal. No, they don't have to. If the child doesn't like pap, that's fine. There are so many other sorts of carbohydrate. There's rice, there's all those, even all those swallow you mentioned, they are things your child can eat. The child does not always have to drink pap, you know. And for those who always want to give children pap 24/7, please stop. That is not ideal. It's okay, they can take pap as one of the many different kind of meals they can take, but not that they have to take it all the time. And if a child does not want to take pap, it is also fine. It is not written in any constitution that children have to take pap every day. No, they don't, or they don't even have to take it at all. As long as they're eating other food and you're giving all the other different kind of food, the protein, the fruits and veggies, the all the food, the animal protein and all that, that is okay. All right, let's just take one more question and we'll go back to Instagram. My baby is a year 7 months, he can't speak yet, so 19 months old, but can make audible sounds that you can understand very well. I'm not sure what we need to understand in a sound. Sound is sound. Or do you mean the child is using the sound to communicate to you? I'm not really sure what you mean by sounds that we can understand very well. Anyway, but I'm worried if an 18-month-old or a 19-month-old does not have any word at all. So at that age, at least they should have nothing less than 10 to 20 single words. So they should be saying mommy, daddy, this, that. They may not be combining the words together, but at least they should be saying a lot more than 10, 20 words. So I want you to see a speech therapist. Let them do an assessment for the child. Can the child hear? Because that's the first thing we want to make sure. Can the child hear? We want to do a hearing test. And if the hearing test comes back normal, then we know it's a speech therapy thing. So if you can also get the hearing tests, done, that would be lovely. And so that's what we recommend for that age. All right, let's move on. I'll come back to this Facebook so that I can answer Instagram people. Omolola, Oyenoga, good afternoon, Doug. Thanks for the good work you're doing. God bless you. Amen. My question is, what else can I get to my baby who refuses cereals and purees? How old is your baby? I always like to know the age of the baby. It's so important. But Omolola, I think I just answered your question with the question I answered for Amanda now. It's not compulsory for your child to take cereals or purees. There are other food that your child can take, okay? So all the food you eat in your house, you can offer your child. You didn't tell us the age of your child. Did you put it down? Because I need the age of that child to answer the question. Oh, birth weight is 3.3. Malala. Okay, maybe just 6 months old. But so just relax. At 6 months, you are just starting complementary feeding, and it's a gradual process. Keep breastfeeding your baby as much as you were breastfeeding before, and then you now start to give other food. And the quantity you need to give is not the same quantity your baby was taking as express breast milk or something. So you really need to give when you are first starting, some days it could just be 1 spoon you want to give, and that is okay. Then the next day it could be 3 spoons, then 5 spoons. That is how you increase gradually, introduce your child. Some of us are always in a hurry. You want your child to take the whole bowl of cereal or whatever they want. No, it's not going to happen. You're going to do it gradually. So if you're, I don't know whether you're in our Facebook group. If you can go to our Facebook group, we have a guide session, and we have guide 2 on complementary feeding, and we have all these lovely videos made by Global Health Media, and you can watch them. It introduces you to how to go about complementary feeding, how many times you need to feed your baby, what quantity you need to give, what kind of food you can give. You don't have to give cereals. You can give all the other food, like I said. It's just that when you are starting, we want you to give something semi-solid, like porridge, like, and whole mashed food. Then as they get by 8 months, 9 months, you can start giving them more solid, soft but more solid. And then by the time they're about 1 year, we expect them to eat everything you are eating as well. So it's a gradual process, and you don't give one food day one and so the child doesn't take it, then you go to day two. You have only been doing 2 weeks of complementary feeding. So ideally you should not have got more than one or two food, because we expect you to do one food for at least 1 week. Don't say the child has rejected something within just 1 week. I mean, you have not tried enough. You have to offer and offer. And then when you are offering, don't aim for, I need to finish this whole bowl of anything. The goal is let them take a little at a time and then gradually increase it. So if you can watch all those videos, or you can check on our website as well, we have an article on complementary feeding, or you can listen to the podcast, in fact, feeding in 1,000 days. All those things are clearly, I think the most important thing for you to understand complementary feeding and how to go about introducing complementary feeding. Remember that even at 6 months, the breast milk is still the 80% of that child's food, where you are now gradually adding other food. So there's no rush and there's no hurry. And it's patience and persistence, and eventually you will get there. But don't give up. Some of us tend to give up too soon. So don't give up too early. Your baby is just 2 weeks over. 2 weeks of complementary feeding, you still have a lot of time. Just continue, and please don't bottle feed complementary feeding. Use cup and spoon, and texture also matters, and all that. And don't force feed the children and all that. There are lots of tips. If you also check on our Facebook, on this Instagram, look through all our posts, you will see a lot of tips on complementary feeding. We call it ATP feeding tips. They are very useful as well. You can just go through them. All right. Fifi Fion. Good evening, ma'am. Well done. My son is 2 weeks. His never has not fallen off, making up to delayed circumcision. There's no problem. So baby's navel or cord may not drop until 3 weeks. Some may not drop until 1 month. There's nothing to worry about. The most important thing is to keep the cord clean. Okay, so make sure you are cleaning it very well with methylated spirit with every diaper change, at least not less than every 4 hours. Make sure you clean it properly. Please do not cover the navel with the nappies or with the diaper. Don't cover it. Leave it open, exposed to hair, and then make sure you clean it properly. There should be no yellow stuff around the base and everything. And that's it. And it will eventually drop off. Don't apply it hot liquid or dry it. No heat at all. No powder, no methylatum, no cow dung, what else? No toothpaste. Don't do any of those things. Just clean with methylated spirit. Keep it open to hair and let it be exposed to it so it can dry, and it will eventually fall off. Okay, that's number one. Number two, it doesn't really have any link to do with circumcision. Some people just worry that if the cord has not dropped, maybe the healing ability of that child is not yet fully developed. But All those ones are just assumptions. It does not mean anything about if you want to go circumcise your child, especially if you are going to use the placebo method. You can go ahead and do your baby circumcision. But again, circumcision too is not an emergency. You can always do circumcision whenever you want to. All right. Okay, yes, Mola, I've answered your question. Okay, I've answered Fifion's question also about circumcision. It's up to you, really. If you are going for placebo, there's really no reason why you cannot do your circumcision if you want to. But if you also want to wait, there's also no emergency about circumcision as well. All right. Okay, I'll come on to Facebook again. Okay, Amanda, I think I've answered your question about swallow. Yeah, once you post your question once, don't repeat it. I will answer them. I answer them in the order in which they are dropping on my screen. All right. Good evening, Doc. My 8-month-old started running temperature, blah, blah, blah. Check temperature 38.8. Okay, that's high. I give paracetamol. Yeah, it didn't subside. I repeat after 6 hours. Good. After that, it's 9.1. Yeah, you have to go to the hospital. Okay, but since then the temperature has been okay, 36.5. Okay. My question is, there a need for her to see the doctor? She's playing and eating well. Just watch if your baby had fever for almost from church, almost till midnight was 39.1. Just watch what will happen this night. If it is still low, no problem. You don't need to go to the hospital. But if the temperature rises again, you have to go to the hospital because some fever tends to have that pattern. And that's the kind of pattern we have in malaria fever. We call it intermittent fever. So they tend to rise at a certain time of the day and drop at a certain time of the day. So, but if by the end of today there's no more fever, that's fine. You don't need to go to the hospital. But if your child should have fever again, you have to go to the hospital. Florence, what was your first question? Yeah, okay, that's the question about the 90-month-old not talking. Yes, I already told you have to take your baby to the speech therapist. I am worried if a 90-month-old has no words. I am worried. So, rule of the thumb, a 1-year-old should be having at least one word, single words. 2-year-old should be combining two words together. 3-year-old should be combining 3 to 4 words together. A 4-year-old should be talking like an adult. I should be able to have a conversation with a 4-year-old whom I've never met before, and I should have no difficulty understanding what a 4-year-old is saying. So those are the rules of the thumb. So if a 19-month-old is having no words at all, I am definitely worried about it. That is significant speech delay, and I really want that child to see a speech therapist and or developmental pediatrician. All right, America, my daughter lymph node under the jaw is swollen. Okay, we noticed it when she had a boy, yeah, and the ball has gone, but the lymph node has not yet gone back. It will go back. It may take a while, but it's fine as long as it's not getting bigger or getting. It's not painful or red when you touch it. There's really no reason for you to worry about it. It will still go down. You don't need to apply anything to it. Just leave it alone. Just leave it alone. You don't need to give any drugs for swollen lymph node. Swollen lymph node is an information that's all that is telling you something. It's telling you that there was an infection, and you already told us that your child had a boil, and now the antibiotics have been given and the boil has gone. So the lymph node itself will go down. So the only time I will worry is if the lymph node itself is getting bigger, is red, or it's painful when you touch it, or it's hot when you touch it. Because if those are present, then that means that the lymph node itself is now infected and that needs to be treated. But if it's just the lymph node is swollen, nothing else is happening with the lymph node, it's not getting bigger, it's not red, it's not hot, it's not painful, just leave it alone. It will go down on its own without any problem. All right. Thank you again for the opportunity. My question is, I noticed for the past 3 days, my baby pulls more frequently. How old is this baby? 7 months old. Always start with the age, not at the end, because as I'm reading, I want to start forming my idea of the child I'm talking about. 2 to 3 times a day is fine. Is it watery or is slimy, hard mucus, partly swings, blah blah? 8 months today. Birth weight 4 kilos. Okay, all right. So, um, what are you giving me? Millet, guinea corn, tiger nut. As much as possible, avoid all this mix of pap mix and stuff. Try and give your child different things, and try and do variety. And because sometimes when you do all this mix, you will never know which of them your child is sensitive, allergic, or intolerant of. So it's better to give each of those things one separately and be sure the child does not have any allergy, intolerance to them before you give them together as a mix. So I'm not really a fan of all these your mixes and all that. I'm not saying you can't give, but before you give them as a mix, make sure you give each of them separately and there's no issues whatsoever. So that's number one. Number two, pay attention to the hygiene around your baby's meal preparation. And I hope you're not bottle feeding. Please, no bottle feeding of complementary feeds, okay? And when you're adding your milk, make sure you're adding the right mix of milk to the right quantity of your pap and all that, because the same amount you would have added to the water is the same amount of milk you add to the right amount of pap. And please, cup and spoon, it should be thick porridge, not liquid. When you take a porridge with a spoon, and you should be able to turn it upside down and it should not flow. That is the texture that we want for porridge or pap or cereal at 6 months old, because some of us make all this watery pap or cereal and then we give it through bottles. These are things that predispose our children to diarrhea and stuff like that. So no bottle feeding, thick porridge, give with a spoon. Make sure you're not also overfeeding, and make sure that the amount of milk you're adding is the right quantity, and hygiene and washing before making food, after making food, when changing diaper, hand washing, soap and water all the time, very important. And also monitor at this age, 8 months old, they start playing around, touching toys and picking up dirty stuff, putting it in their mouth. So make sure you're also washing the hand of the babies as well. Make sure you maintain hygiene around them. Make sure all the places where they're crawling and all that, you're mopping them using all these antiseptic stuff to mop them. Even the toys drop, make sure you are picking it up and sterilizing it before they put it back in the mouth. So you really need to pay attention, because at this age they are more exploratory and they are more exposed to germs. So you really need to also up your own game as well. But otherwise, I won't worry so much about this baby. I just want you to just pay attention to some of those other stuff that I mentioned, and your baby should be fine. All right. With Amaka Hineloli. Amaka, I'm not sure we've seen your question before. Let me go up. Okay. Okay, Amaka, okay, you are the one that asked question about lymph node. All right, okay, no problem. The answer is still the same. Thank you for telling us the age. All right, let's go on. Facebook user, if Mantle sweat a lot in her hair, what can I do? There's nothing wrong with sweating. Just make sure the house is not too hot. It's just cool the house, okay? So if your child is sweating a lot, it's either the hair is heavy and your room is hot and the weather is hot. So just do something about that. So make sure that the house is cool, is well ventilated. It's okay to use fan, it's okay to use AC for children. Please just use everything moderately. And is it compulsory to wear beads on the wrist and ankles of newborn? For where there's no link. The beads and the whether on the ankles or the wrist, they don't do anything to the babies. And I really don't want you to even put beads on them. I know some people do it as a beauty thing, but I hope they don't become too tight and obstruct blood flow. That is what I'm thinking of as a pediatrician. So please, they don't need to have all these ankle or wrist beads. I don't know what myths they've told you about it, that maybe it's doing something. It doesn't do anything. And we worry about it in terms of the risk or danger associated with it. And for babies, before one bead will come and lose, then babies go and swallow it. These things can happen. So please, just don't put it at all. It doesn't have any benefits. It actually has more risk. because of all those risks I've mentioned. So there's no, doctors don't want you to put beads on your children at all. Right. Gift say, my baby was immunized, the right eye is still swollen. Okay. When I touch it, it's paining him. How old is your baby? Gifts always start with the age of your baby. Tell us when, how long ago was this immunization done? Because immunization on the thigh, sometimes it can get infected and your child can have what we call cellulitis or abscess in that area. If this is painful, if it is red, if it is hot to touch, if it is looking like it has pus inside, you have to take the child back to the hospital because they need to drain the pus out. They need to give antibiotics. But if it's just swollen and no pus, and what we normally advise that you should do is that when you come back home after immunization, just put ice pack. So you just get a little handkerchief, put a little bit of ice cubes inside, tie it, and just put it gently. One minute, one, and will take it out. 5 minutes later, you put it gently like that. You can just be doing that, and you can give your children, if they have fever, give them paracetamol. So you do that for a couple of days. Don't massage. Don't apply petrol, kerosene, toothpaste, all those things people apply. Please don't. Just apply the ice pack and don't massage. You don't need to rub anything. Don't rub ori, don't rub shea butter, don't rub. Just pull the, because what is happening is that when they give injection, that penta vaccine or DPT, whatever they gave your child, it's a deep intramuscular injection. So when we give that injection, there's some bleeding, okay? It is that bleeding into the muscle that is causing that swelling and pain. So what we want to do is that when we put ice pack, you are stopping the bleeding. You are stopping it from bleeding the more. But when you rub, you are making the bleeding to, you are what we call vasodilation. You are exposing the vessels that are bleeding to bleed more, and the swelling will go more. And then your hand, all those massage, you are introducing germs. So blood under the skin, germs introduced by your hand from massaging and all that, is a very good culture for infection. That's why some children will now develop pus inside, and then we now have to start taking out the pus. We now have to start giving them antibiotics. It becomes another hospital admission. But all you need to do is just put ice packs, give them paracetamol. 2-3 days, most of it will go down. Now the blood itself will become organized. It will now form like a lump. Okay, so when you bleed, it will form a lump. It's just like clotting. It's forming inside the muscle, so you can still see a little bit of swelling. And some of you do complain, oh, the lump is still there, but it won't be painful, it won't be hot, it won't be red. You don't need to worry about that one. Just leave it alone. It is just a kind of what we call a healing tissue, that has organized under into that muscle, and the body will remodel it over time, and the swelling will go down. Please don't say because of that you will not go for the 14 weeks or the 10 weeks immunization. Please go, and they will still have other spaces on that body to give the immunization. The immunization is more important than that swelling of your child's thigh. The killer diseases, the diphtheria, the pertussis, the tetanus, they can kill children. So they are more important to take immunization than to say because my child has a small swelling on the thigh, I won't go for immunization again. The swelling on the thigh will not kill the child, but diphtheria, pertussis, pneumonia, and all those are things that can kill children. So please go for the immunization. Leave the swelling alone. It will go down. But if it is red, if it is hot, if it's looking like there's a pulse inside, it is painful, then that is telling us there's infection. And at that point, you have to take your child to the hospital for antibiotics treatment. And sometimes we have to open it up and bring out all the pus that has accumulated inside. So gift, I hope that's helpful. All right, let's just quickly take a few more questions on Instagram, and then because my time is running up now. All right, Jessica, say thank you, ma. Okay, Damilola say I've tried to pull. Okay, okay. She raised her head, and sometimes she raise her chest. Okay, so you know what, Damilola, I think you should just get a doctor to do this thing. I will be more comfortable. I'll be more comfortable if you let a doctor do it for you, because I'm not really clear what you're saying. Or what you can do is that take a video of you doing it and send it to us on our Facebook group. If you do a picture or a video of it, 1 minute, just do it. I have some of the pictures on the Facebook group where you can actually see us do it. Just do it, send a video, and I will tell you straight away which one it is. Or you can just say doctor and let them check your baby for you. Funky Beauty, what could make 12 weeks old baby have low PCV of 28? So the doctor who did that PCV of 28 should have told you, because there are many things that would have made a child's PCV to go down. And there's a reason why your doctor did the PCV in the first place. We don't do PCV for every 12 weeks old. So your doctor must have done the PCV for a reason, and they will be able to answer this question to know why. Okay, your baby was born at 38 weeks. Current weight 2.9. 2.9 at 12 weeks. Okay, that's why your doctor is doing the blood, because your baby is not thriving at all. Your baby is 2.6. 3 months is 2.9. That is just zero point 0.3 kilos for 3 months. I am definitely going to be worried about the baby. Your baby is going to stay in the hospital and not go home. Yeah, and this baby is not thriving at all. So your doctor is obviously worried about your baby, and obviously I'm worried as well, because we expect your baby to gain 30 grams every day. So your baby should have added nothing less than 2.7 kilos at 3 months, at most 2.5. So if your baby is just gained 300 grams, this child is not thriving and something is not right. I'm not surprised the child has no neck control. The child has not gained, but the child is still like a newborn baby. So some newborn babies even weigh more than 3 kilos at birth. So your baby is weighing almost 3 kilos at 3 months. We are worried. So I hope you're seeing a pediatrician, and I hope your child is with them and they are telling you, they should be talking to you, they should be telling you what is wrong. Something is definitely not right. The first thing we look at is food. Are you feeding this baby? We want you to do exclusive breastfeeding. If you are lactating and your child is eating well and your child is sucking and the child is not gaining weight, it's not smiling, something is not adding up. So I'm worried about your baby. So please, if you are not seeing a pediatrician, that's the person you should be seeing. Don't go and see any general doctors. This is not a spite on general doctors. This child needs to be with a pediatrician. This child needs to be on admission, really. I don't know what they're doing right now, because they need to know what is going on, why the child is not thriving, and that can explain everything. That may also explain the PCV. The PCV is the least of the baby's problem right now. I'm more worried about that weight, but it may be part of the whole picture, you know. Funky's Beauty, please let me know how your baby is doing. You can send me a DM and let me know where your baby is, because that baby needs to be with the pediatrician now. That is very important, so we can quickly get to the root of it. All right, Hesty Love, good evening. Thanks for all you do. What's the best way to prevent malaria in a 4-year-old? Okay, give mosquito nets, long-lasting insecticide mosquito nets. Get rid of all the bushes, the water, all those things around your area. Sometimes you need to fumigate your house. So get rid of the mosquitoes, then your children will not have mosquito bites, and then they will not have malaria. That's all we can do at this age. We are hopeful we're going to get malaria vaccine very soon, but then I think we're going to target the under 3, not 4-year-old by then. All right. No, we don't give drugs to prevent malaria. We used to do that before. We used to give Sunday medicine. I grew up taking Sunday medicine and all that, but we've stopped all that. So we don't give drugs to prevent malaria unless you are from abroad, like you are coming from UK, US, where there's no malaria. If you are coming to a country like Nigeria, where there's a lot of malaria, you don't have any immunity. So those are the kind of children that will give what we call chemoprophylaxis. So we'll give you drugs to prevent malaria. We also do what we call seasonal chemoprophylaxis, but again, it's for children between 3 to 12 months. We tend to focus on those children who are likely going to have severe malaria. So in some parts of the northern Nigeria, during the period that we know most children are going to have malaria, we give them chemoprophylaxis, but it's not something we do a lot. So, but routinely, we don't give all children drugs to prevent malaria. And even for the chemoprophylaxis, the seasonal chemoprophylaxis, the health workers will come to your house to give you the drugs and how to take it and all that. So, yeah. So, but just make sure your children don't have mosquito bites. That is the main thing. Make sure your house is fumigated, or at least no bushes. Fleet your room. Let them use insecticide treated nets and all that. As long as they don't have mosquito bites, they won't have malaria. That's the most important thing to do. All right. Okay, that's all for Instagram. Let's just take the last few questions on Facebook, and then we'll round it up. Time is already up. When my was immunized at right time. Okay, I think Gift, we've answered your question. Um, Good evening, my dog. Baby is 5 months, 2 weeks old, has boil on his head. To the reaction. So boil is not a reaction to anything. Boil is a bacterial infection from what we call staph aureus. So it's either your baby doesn't have a boil or your child has a boil. Okay. And if your child has a boil, it is not a reaction, it's an infection. So there are two different things. So, but I think the best thing is for you to it's okay, don't mention the name of the oil. The best thing for you to for either take a picture and post it on our Facebook group so we can see the picture of this swelling, what you're calling boil, and then we can advise. But most likely boil is not a reaction to a oil. It has nothing to do with the oil. It's more of infection. It is from the hands of those of you who are carrying a baby that your baby is likely going to get the boil from. But I'm not even sure what you are talking is a boil or just a reaction. But I think you should just send us a picture and then we can advise you. Folashade, what does my 3 month old breathe faster? Folashade, we have to count the rates of breathing of the child because your own faster may not necessarily be fast. Okay, children generally breathe faster than adults normally. Children normally breathe faster than adults normally. So sometimes when parents say the children are breathing fast, you are comparing it to your own, but normally we expect babies to breathe fast. So what we normally do is to count the respiratory. So if you think your baby is breathing fast, you have to see a doctor or a nurse. They will count the respiratory for 1 minute and then they will let you know whether it is fast or it is not fast. All right, so we need to do that, then we can advise you. But without counting it, I can't say whether you are right or wrong. You may be right, but we still need to be sure. 8 month old baby sit without support. Okay, Croswell hosting to stand here. So since workers are not advisable, what can I do to help her walking? What did you do to make her sit? What did you do to make her stand? You didn't do anything. The baby did it by himself or herself. Hey, girl. So yeah, it's a girl. So you don't need to do anything to make your baby walk. Your baby will walk when the baby is ready to walk. The same way you didn't make the baby to sit, you didn't make the baby to crawl, you didn't do anything about all those milestones. The same way you don't need to do anything about walking. The child will walk when the child is ready to walk. And for your information, walkers don't make babies walk. That is a misnomer. How do you call it now? So it's just a name that manufacturers give. Those workers are not, they don't make babies to walk. They are very dangerous pieces of equipment that is not recommended by pediatrician, that is not recommended by physiotherapists, has been banned in Canada. So you may want to do your research. At American Academy of Pediatrics, we don't recommend workers. So all the health professionals say your baby doesn't need a walker. It's actually going to slow them from walking. And some of them have these rollers under them, and children that are moving, they have no awareness of danger. Then the children are I've seen this thing happen before. If you go on our Facebook group, you can just Google it or search for it. You will see a story of a mom. Some of these children roll down from these workers, suffer severe injuries, and we're talking about brain injury here, disability. So there is, you don't gain anything. I always tell mothers, you have a worker, just throw it away. Don't even give it to anybody, just throw it away and don't buy it. All right. So your child does not need any worker. Lots of children are working without workers in their house. So you don't need to do anything about working. Developmental milestones, children achieve it by themselves without your intervention. It is their brain that is growing, and it is their brain that is telling them when to do this thing. And that is why when children are done doing certain things, we worry whether there's something going wrong in the brain. It has nothing to do with whether you give them equipment or you don't give them. No, it has nothing to do with it at all. So just relax. Your baby will soon walk. Your baby is already standing. Baby will walk, and you don't need to do anything about it. Just look and watch. All right, 12 weeks old baby is coughing hard, running nose. What do you do? If baby is coughing hard, I worry about the hard part of the coughing, because I would have said cough and catarrh is viral, it goes by itself. But if your baby is coughing hard, you may want to see a doctor. Let's be sure there's nothing else going on with that chest. So otherwise, I'll just say watch. Make sure you're breastfeeding your baby exclusively. Keep your baby away from people who are coughing. Keep your baby away from cigarette smoke. Keep your baby away from generator fumes. Smoke from your kitchen. Those are the ways to protect children against cough and catarrh. Children don't pick cough and catarrh from the head. They pick it up from people who have similar thing. And so if you take precautions, the children will not have it. So that's what we need to do. Can you recommend any hospital in Abajo? We don't recommend any hospital. If you are not sure which hospital to go to, you go to the government hospitals. I think you have a teaching hospital in Aba, you have general hospitals. You can go to any of those government hospitals. At least we know government hospitals tend to screen their staff and they make sure they have the right kind of professional, but we don't recommend specific hospitals or specific professionals. That's not what we do. All right, finally, I think I've gotten to the end of today's ATP Live, 11 minutes later than normal. Oh my goodness, there's a question on Instagram. Okay, Chief Edgar, let's just quickly answer that. My baby 1 year is running temperature, malaria. What is the best of malaria? So who made the diagnosis of the malaria? Because your child was sick. I have a feeling you took the child to the hospital. All right, because that is the right thing to do. Let's go to the hospital when children are sick. Don't go to the lab. No, don't go to the lab. We need to stop wrong things that are not good. And things we do in Nigeria, one of the things that are not good is going to the lab without the doctors. It's a doctor that should tell you whether you should go to the lab or not. It is not the lab that should just test your child. Okay, now that they've tested your child, have they treated the child? They can't treat the child. So, and some of them even treat the child, but it's wrong. So let's do things in the right order. Your child has fever, give paracetamol. Child fever is not going, go to the doctor, not the lab. Let the doctor examine your child. There are many things that will cause fever in children, and it is not only malaria. And some of these labs every child in Nigeria is going to have malaria in their blood, because that's the only thing they will ever see. And some of them, I don't even know whether they did this malaria test before they see malaria 1+, 2+. That is the reality of things. I know some of you may not. I'm not saying all the labs are like that, but that is the reality of some of these hospitals or labs where you go to. Everybody must have one malaria there. So is the doctor examining your child, listening to the chest, checking the ears, looking into the throat, making sure there are no infections there. Everything is not always malaria. And that's why some of what we treat malaria, the child is still not better, because it's not malaria. Okay. And so it is important to go to the hospital first, and they will be the ones to write the drugs for you. We don't recommend drugs on air. I always tell people that, because there are a lot of things that go into prescription of drugs. How do I know your child is not reacting to the drug I'm going to give? There are questions I need to ask you around that, okay? And that is why it's important that a doctor has to see the child and recommend her. There are anti-malarials you can use, of course, but we need to be sure, and then you have to know the weight of your child to know the right dose. So all those things are important information. And then when I give you drugs, I have to tell you about the side effects. What to do if there's side effects? When do you come back to me? So it's taking prescription is a contract between you and your doctor. Anybody cannot just do it, all right? Because that person is taking responsibility for all the possibilities that comes after that. So Chief Edgar, you still have to go to the hospital, I'm sorry, and let a doctor see your child, decide whether they agree with the diagnosis of malaria, and then tell you what to do, what to give, and dose and all that, which unfortunately I'm not able to do. Sorry about that. All right. Unique cakes gave birth. Maybe it's a week old. I've been on exclusive breastfeeding, but I started having sore nipples. Okay, that because your baby is not breastfeeding properly. Your baby should not be sucking on the nipples. Your baby have to suck on the areola. So I really need to get a picture of the breast and the areola, because the part of the nipple that is black beyond the part of the breast that is black after the nipple, that's what we call the areola. That is where your baby's mouth should be, not the nipple. So if you're having sore nipples, it is poor attachment of the baby to the breast, and breastfeeding is 99% attachment. If you don't get the attachment right, you are going to have painful nipples, painful breastfeeding, then you're going to get frustrated. The baby is also going to get frustrated because nothing is going to the mouth of the baby, and that's why they are biting the nipple more. because they are trying to force something out, but they are not going to get anything biting on the nipple or sucking on the nipple. The breast milk, the milk sinuses or bank where the milk is stored is under that areola. So you have to make sure when your baby wants to suck, don't just let them grab the breast straight away by themselves. You have to make sure the baby's mouth is open wide and you put most of the breast in the mouth. Make sure that areola you barely can see it. That's the appropriate way to breastfeed. Once you get that right, you'll find that breastfeeding is simple, is pleasurable, is stressless, and the baby will be satisfied. Baby will have enough breast, and baby will sleep. So that's what you really need to do. All right. It has something to do with your baby being an heavy feeder. Your baby is being in quotes an heavy feeder because your baby is not getting anything, and that's why the baby have to keep sucking, sucking, sucking because nothing is coming out. So you have to make sure, and then if nothing is coming out very soon, you're going to start having breast engorgement. You're going to start having pain, and then you're going to need antibiotics and all that. So you need to get it right. So if you're on our Facebook group, go and watch all the breastfeeding videos, or on our YouTube, or watch the breastfeeding videos. They show you how to, it's a video, so you can see how to do the proper attachment of the baby to the breast and how to breastfeed successfully. You need to get it right. Breastfeeding is an art. It's something that you have to learn, and sometimes we have to show you how to do it, or you can watch the video to see how to do it. And once you get it right, everything will be fine. So you don't need to take a break. If you take a break, you're going to cause the problem. You just need to make sure you get it right. Okay. If you already have like wounds or around the nipple, you can express so that the nipple can heal. And there's also a video on what to do when you have those kind of sore nipples or breast pain. You can express your breast milk and give the baby a cup and spoon and wait for it to heal. But if it is not like you have wounds or not, like just you are feeling the pain because baby has been biting on it, you can keep breastfeeding, but make sure the baby is not sucking on the nipple. Both have the areola in the mouth, and your baby will be fine. But don't stop breastfeeding, because if you stop breastfeeding, you can wean your baby completely and the breast is going to stop flowing, and that's another problem on its own. So you have to make sure the milk keep flowing so that you sustain your lactation. That's very important. Yeah, I can feel you. I know you'll be feeling much pain because, and unfortunately, it's that poor latching. Sorry, take painkillers, take paracetamol, and do a little bit. Because you also get the breast, because your milk is not flowing out now. You're in pain. The baby has been biting your nipple. It's a vicious cycle. But once you get it right, you can just express your breast with your hand for now and get out the milk that is there that is causing you pain, and then the baby suck on that. Take the express breast nipple. Get it right. There's a video for you on breast pain and nipple pain as well. So just go and watch all those videos. Get it right, then you'll be fine. Unfortunately, some of our hospitals we are supposed to be showing you all this thing, but some of us were always rushing home too. And if you're having difficulty, you should have discussed with our nurses. They will show you all these things. Chivega, you were late. I already say you don't take injection for your children when they have malaria. If your children are not sick enough to be admitted to the hospital, they should not take malaria injection. Only these children that you are taking to the lab by yourself, they are not sick enough for any malaria injection. They need to take oral anti-malaria. I've already talked about that. Maybe when you watch the video again, you will get the answer. Unique, I've just answered your question. Breastfeeding. I mean, yeah, you're the one asking question on breast milk. Yeah, but just answer your question. I hope you've gotten it now. Oh, sorry. Yeah, okay. I think I've answered everybody's question now. Yeah, I think so. All right. Thank you so much. Oh my God, I have to go. So if you still have questions, please post your questions to the Facebook group. All right. So those who are asking questions about speech, I've answered that question. You can watch the video over again and you will get the answer to that question. Clapping is not a 10-month-old skill. Just relax. Your baby will clap later. All right. Okay. So thank you so much, everyone, for your time, for listening to ATP Live today. If you are late, don't worry. Almost all the questions I'm seeing coming up now, I've answered them today. So just watch the video all over again. You will get answer to your questions. But if you don't see the answer to your questions, please go to our Facebook group Ask the Pediatricians. You can't miss our Facebook group. It's one of the largest Facebook group for parents, so you won't miss. Just type Ask the Pediatricians. If you see a group with 700,000 members, that's the group. There are some few fake of them, but you will notice that there are not many there. So just go to the right one, and then you can post your questions there. We will answer your questions in the next 24, 48 hours. And if you want to learn more, please go to our website, www.askthepediatricians.com. And you can also listen to our podcast. You can also watch our YouTube videos. We have YouTube videos specifically for each of those topics. Now, where have done extensive teaching on some of these topics, like on breastfeeding, on complementary feeding, developmental milestones. You can watch or you can read about them as well. That will give you detailed answers as well. So till I come your way again next week, by God's grace, make sure you keeping our children healthy, and also don't forget to listen to ATP Hour on Thursdays by 10 a.m. As much as possible, I try to do a whole hour teaching on important topics that relate to the health of your children. So um, feel free to listen in or watch it after at your own convenience. It's always going to be available on our pages. Only on Instagram we don't put ATP Hour, but you can watch it on YouTube, on Facebook as well. All right. So thank you so much, everyone. And Funky baby, that baby that is not thriving, I really want to know what happens to your baby. So just send me a DM. So that I can follow up on your baby. All right. Thank you so much. All right. Good night, everyone. Bye. Bye. Have a wonderful day. Bye, 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 bye.